A lot of women come in to the OBGYN office specifically asking about permanent methods of sterilization, and they're seeing media blitzes about this Essure technique and have a lot of questions about it. And I'm a big fan of the hysteroscopic Essure sterilization procedure, and that's a big term for a simple tubal procedure that we do in the office. Women that seek permanent sterilization really have two options out there, and one is the old gold standard laparoscopic tubal ligation, where you make an umbilical incision, go in and burn and cut tubes. And about 10 years ago, a new technique called the hysteroscopic Essure sterilization came out, and it afforded women an opportunity to have a procedure done in the office with much more convenience, less cost, no hormones involved, no incisions involved, and really no recovery. And that's become a very attractive option for women. Many actively seek it out now, and it's a common part of our practice here. When the patient comes in, she's already taken her sedative and anti-anxiety medicine before she gets here. So we like to say she's going in a happy place before she even gets here. And we put her in our procedure room. She lays on a table with feet in stirrups. A speculum is placed in much as it would for a pap smear. And we take a little device and grab the cervix and dilate the cervix up to about 6 millimeters, which is not unlike a ballpoint pen in thickness. Once we do that, we then take the hysteroscope, which is simply a camera that we're watching on a TV monitor. We insert that through the cervix. We identify the tubal ostia. There's a tube on each side of the uterus. We identify those tubal ostia. When that is done, we then take our Essure device, which is a tiny nickel titanium alloy, slide it into the tubal ostia to a certain level, and there are markings on the device that clearly identify that for us, and then just simply hit a release button. They have a polyester fiber filament there that creates an inflammatory response, creating a tubal occlusion that takes place over about 3 months. We also do a confirmation of tubal occlusion procedure where they inject dye into the uterus, and that confirms the blockage of both tubes bilaterally. Now, we also encourage them to maintain their current method of contraception until that is confirmed. The failure rate is outstanding. It's better than any other form of permanent sterilization. Current studies show it's 99.83% effective. Okay. You also heard me mention that we use a nickel alloy in the tube. Some women are concerned about allergies to that, and recent studies indicated that the dose of nickel exposure is less than 1,000th of the daily dietary intake of nickel. So it's really not an issue in women. There have been concerns in the past about that, but that's been alleviated now. We don't have to worry about that. During the procedure, at most, patients generally say they feel like a menstrual cramp, but nothing too severe. Again, they've had pain medicine, a little sedation to come in here, and they certainly have an extra pill or two that they can take at home if they need that. But again, when things go well, I've done them in as fast as 2 or 3 minutes. Most of them generally take 5 to 10 minutes. Most women choose to do the Essure technique as opposed to surgery for about 4 or 5 reasons. One, there's no incisions, therefore no surgery. It's non-hormonal. They don't have to take any hormones to have this done. The recovery time is almost instant. I mean, my wife had the procedure done. The next day she rode horses, worked out at the gym, walked 3 miles, no recovery. And again, cost. Anything you can do in the office as opposed to an operating room is generally going to be much cheaper. And many insurance companies charge only an office copay to do this procedure, which is dirt cheap compared to a deductible and a co-insurance that can add up to hundreds or even thousands of dollars to have this done in the hospital. Some insurance policies still require a deductible be paid for the procedure, but again, the co-insurance and the total charge is going to be thousands less than one that's done in the hospital. This should be considered a permanent technique and non-reversible. Okay, so we need to be 100% sure that this is what we want before we consider permanent sterilizations. We have other techniques that are temporary and even longer term, but not considered permanent, except for the surgical tubal ligation and the hysteroscopic Essure. So I want to make sure that women are very comfortable with that choice before they dive into that.